Hello, everybody. How you all doing today? I hope you're having a happy Friday so far, and I'm excited to present to you what we have for today. In This Week in Supervision. This Week in Supervision is the opportunity where we talk about what's going on in the supervision groups, what I have discussed, help support individuals who are looking to bring content to their supervision groups to be able to do that, but also to help clinicians to learn. All right, I like that. Help clinicians learn. Let me write that down. All right, so we're going to get into it in just a second. Uh, but I've got some great stuff, right? And so today our topic is entitled, um, it's entitled "How to Regulate Dysfunctional Clients." How do we regulate? That's what we're going to be talking about. How to regulate dysfunctional clients or dysregulated clients. We got to fix that. Let me start over. All right. So how do we regulate dysregulated clients? Now, the reality is that we don't have the power to regulate anybody, do we? Because we're the clinicians. It's up to the client to be able to regulate themselves. But what we do is provide tools to help them to get balance. So sometimes and we'll talk about this. Sometimes our clients get dysregulated. They can kind of get out of sorts. That may happen in the midst of a session, or it may happen when they're at home with relatives, family members, or on the job, something like that. And what we do is teach them the skills to help to regulate themselves. But let me tell you something. As long as I have been doing psychotherapy, the majority of my career, how many of y'all have been taught to intervene and do interventions primarily strictly based on talk therapy from the perspective of I'm really approaching what's going on in the mind and trying to correct things either through CBT or DBT or something like that, right? Well, there are other aspects of psychotherapy that we are credentialed to bring to the table that involve science. Okay, it involves science, and many times, if a client is being dysregulated, let's just say culturally, I've been to a few funerals and seen a few folks pass out at a funeral. And what is happening there when you observe someone passing out at a funeral? Or let's just say that someone starts to talk about trauma and the trauma gets so intense that they aren't able to hold themselves together and they start to kind of dissociate and coming out of their bodies is how they feel, or start to have derealization where things just don't seem real around them, or having depersonalization where they don't feel like they're inside their person or inside of their bodies. How do you prevent this from getting out of hand or teach them how to regulate themselves when they're at home? That's what we're going to talk about today, and I want to get right into it. Okay, so let's talk about and what we talked about in supervision. And normally, you all, for those of y'all who tune in, kind of probably know the routine by now. And so the routine is what we do is we start off with a case, okay, um, or case scenarios from the supervisees, and then we move into questions. Usually, these are test prep type of questions and things like that, right? And usually they don't already have the answer as I have just given you. Um, but anyway, so we start off with the first question, and the question is a client states, I'm feeling dysregulated. Just talking about, and that is not the question I want. Okay, that's why we did that. Okay, so here we go. What nickname? I hope y'all didn't read that because some people are getting stressed out about that subject. And so we had to talk about that, right? All right. So um here we go. So what nickname is commonly used for the parasympathetic nervous system? A, fight or flight, B, rest and digest, or C, alert and respond, or D, freeze and shut down. So this is what we talked about with the supervisees because many of my supervisees are not haven't been very aware of the autonomic system. I can't really talk about autonomic nerve. I can't pronounce it. Autonomic nervous system. And what we learn from supervision here is that there's a few things that happens when a client begins to get dysregulated. Of course, the thought comes, right? But then some things start to respond and act through their bodies. And this is more how the science comes in. So when I talked about individuals passing out because they've been exposed to difficult situations, right? The loss of a loved one, or they're being dysregulated um, due to talking about trauma and starting to dissociate, or you're starting to see movements and things like that that suggest that they may be about to dissociate. Something is happening in the body. If someone starts to appear like they're hyperventilating or they can't catch their breath because they're so overly excited in a negative way about something that has happened, the body is starting to make them respond a certain way. We're going to get back to that, right? What is the body doing, and how can we approach this in a way that can calm them? So when we look at what is the nickname that is commonly used for the parasympathetic system? We're looking at B is the answer for this one. Rest and digest, right? Rest and digest, because it's this part of the nervous system that brings about well, it works with helping you to rest, digest, calm down. It has restorative functions of the parasympathetic nerve. So, rest and digest describes the calming, restorative functions of the parasympathetic nervous system, right? And the parasympathetic nervous system is that part of the nervous system that seeks to help to calm us down. Okay, helps us to regulate if we become so when we talked about this in our session too. What does the sympathetic nervous system do? And so the sympathetic nervous system is a part of the nervous system that we often refer to as that part that kind of aligns with fight or flight. So when you're exposed to something, you either fight or you fly. That is that part of the nervous system that's activated when that type of thing happens. So if you get scared, afraid, and you're trying to take cover, that is the sympathetic nervous system that starts to activate. Okay, but it's the parasympathetic nervous system that helps you to calm down. Now, this is the key. There are certain uh, modalities of treatment that you can bring into the psychotherapy that directly scientifically supports an individual with calming down their nervous system and allowing for the parasympathetic nervous system to click in. So we showed a video about that, and this is the video that we showed just to educate them a little bit on the parasympathetic versus the sympathetic. Okay, and then these things kind of break down with the sympathetic nervous system. What are we talking about? Anxiety and panic, irritability and aggression. These are things that often we see in our clients that dysregulate them. Okay, and so we know that beneath dysregulation is feelings, trauma, things that need to be attended to, but sometimes it's important to just work with the body. Let me get you calmed down, then we can move into a deeper treatment, right? And so that's the sympathetic nervous system, and then we see the parasympathetic is it helps us to calm down. What's interesting is it says activates digestion. Now, when someone is having trouble, um, in these areas and having anxiety. Look, this says shuts down the sympathetic nervous system. When that's activated, it shuts down digestion and reproductive systems. Think about this. I'm not suggesting this is 100% the case, but what's a common symptom that we see with our clients that experience significant levels of anxiety when they're overly stimulated and they can't rest and can't sleep a lot of times and they're super anxious. A diagnosis of GAD, generalized anxiety disorder. One of the symptoms that we often see is that many times these individuals have gastrointestinal problems, right? So they have issues with digesting their food. Okay, that's likely a symptom of the sympathetic nervous system being overly activated and then impacting the digestion. Okay. Don't quote me on that, but that's my understanding, right? And so we want to learn to counter that, right? And so there's some interventions to do that. But the question that I wanted to ask that I asked my supervisees is what are some symptoms? What are symptoms that we often notice when someone becomes dysregulated? Okay, so let's talk about that. What are symptoms that we often notice when someone becomes dysregulated? We'll get back into that. I also gave them a scenario, and here we have Marcus. He's a 33-year-old male. Marcus, a 33-year-old male, is in individual therapy, related is in individual therapy for trauma related symptoms and chronic anxiety. During his session, Marcus begins to show signs that he may be about to dissociate and or have a panic attack. Okay, so this is your client, right? Think about what you would do. So he shows symptoms. You're noticing this because you're a smart clinician. It's like, it looks like he's about to dissociate. I know my client, looks like he may be about to have a panic attack. And he exhibits shallow breathing. He's starting to zone out and he's shaking his legs uncontrollably. You all had just had a conversation about some things that had triggered him that morning, and he shared these things with you. He became visibly upset after walking into his apartment, is what he said that happened. When he went home earlier in the day or at some time earlier prior to the session, and he was visibly upset after walking into an apartment and seeing it unclean. So he walked into his household and he was married. He walked into his household and it was unclean. And he said it felt like it was a flash. He said it felt like a flashback and that the mess reminded him of his childhood home, which he described as disgusting and chaotic. So he's being triggered, right? Marcus reports frequent emotional flooding when his environment feels disordered. So a disordered environment triggers him, right? And so Marcus then he starts to have a change in his posture, his speech starts to slow down, and he's no longer making consistent eye contact. Okay. So it's something to be understood here, right? It's something to be understood. Like in this situation, Marcus is showing that, for one thing, that his sympathetic nervous system is being activated. He's being overly aroused. He's starting to panic. He's becoming irritable. Okay. And so I asked the supervisees, what are some other symptoms that you might notice that clues us that someone is being dysregulated? Or maybe that they're having sympathetic activation or fight or flight response. If you look at these answers, many of them line up with physiological responses that someone might have, indicating a disruption, right? Physiological, something is happening in their bodies. Rapid and shallow breathing, elevated heart rate. How do you treat that? Right. And the question is, restlessness or pacing, fidgeting, wide or darting eyes, muscle tensions, all these are response to many times when someone is being dysregulated. And many times it starts with a thought, whether it's conscious or unconscious, feeling like I can't calm down. Right. And so, in the situation with Marcus, if he was walking into your office or you were seeing him, he had already walked into your office and you're talking to him, he's becoming dysregulated. What interventions might you use? Some of you all might respond that, hey, I would try to talk about what's rational and irrational about the things that are making him afraid. And I'm not saying a little CBT in this situation is not an adequate type of intervention, but we don't want to be what they call it, a one trick pony, right? We want to be able to have an arsenal of ways to approach things and more include some more science into it, right? Okay, know that, hey, if I do this, there's scientific proof that these types of things might occur. And I'm going to tell you a little bit about interventions that you could use that are more scientific based, or don't involve just strict talk, like talk therapy. Okay. It involves some other components, right? But just before I get into that, I do want to share with you about, let me stop my screen. I want to share with you about an upcoming continuing education. We have a free training coming up, y'all, and it's coming up very shortly. Of course, as you know, if you ever watch, I'm not going to be able to bring that up right away. And so we'll find it somewhere on the screen here. It always disappears from me. But we do have a free training coming up on this Tuesday. If I can't find out where it is, it comes it's this Tuesday at 5:30 p.m. We have a free training this Tuesday at 5:30 p.m. We want you to attend, and this will be virtual training. Okay, so it's online, virtual, and we definitely want to see you there. And so then when I find that, then I can't find the screen to share. Here we go. I need a technician to help me out here. Let me tell you. Okay. And so then we just really quickly, and we're going to get back to what we're talking about here. Okay. And then we have the social worker supervisor training. July 28th. If you're looking to become a supervisor, now, if you're a supervisor and you are supervising your clinician on site in Alabama, depending on the plan, you can actually bill insurance for the services that your supervisee performs as far as the psychotherapy. That's a new rule or a new change in the Blue Cross policy, Lucid, when they're connected with that Lucid plan. All right. And so we have that. And then we have this. Here's the free training. If you're part of Social Workers of Alabama, that's going to be presented by Nikki Arnold. And she's going to be presenting to us Understanding Invisible Wounds, focus on traumatic grief. Any trauma stuff I love talking about. That's one of my specialties. And then we have the DSM-5. We have a new training, a new DSM-5 training. If you have not already taken the one that we have a new one, and I'm going to get you that information. And this was an exciting training. And so this is for those of you all who are just in need of CUs. Okay, this is an option as well. So let's get on back to what we were talking about here, and we're going to wrap things up. Let's see. Okay, so how do I support my client who might be having significant levels of distress? Okay, so if they're having significant levels of distress, okay, what system is kicking in? Okay, you tell me what system is kicking, what part of the nervous system is kicking in when this occurs? Well, that's likely going to be the sympathetic nervous system, and we're going into fight or flight mode. And so you might experience that your client is short of breath, that they may start to get to the point where it looks like they may want to dissociate and things like that. And so we want to know interventions to help to calm them down per se. All right. And so we're going to get into that. And I'm sharing my screen, I hope. Now, most of my supervisees are already familiar with the 5-4-3-2-1. So that is one of the interventions that you can use. This is a grounding intervention. Okay. So this is not the normal talk therapy. This is a grounding intervention that gets them to not necessarily take deep breaths and things like that, but distract them from the thing that's causing the breath to shorten. Okay, because the anxiety, they're thinking about that situation is triggering something, and what happens, the 5-4-3-2-1 helps them to look at something else. Now, for those groups that weren't familiar with that, then I played this video here, and it's a real quick video, like 2 minutes, I think, to show you how to work with your client with the 5-4-3-2-1. I'll try to attach these links. This was a really good one right here. The gentleman here, he starts to describe a little bit.
Did you know
about
that the way that you breathe can influence the way that you think and the way that you feel? My name is Dr. David McLaughlin, and I'm a consultant psychiatrist. Together, we are going to be doing a breathing exercise, which is really useful particularly for anxiety disorders, for panic attacks, but really for any unwelcome emotion. And this breathing
So that's what you can use it for. Here's a psychiatrist on board with it too. And so he's going to show you and walk you through how to use this intervention. And this one I really enjoy. I really like this one. And this is called This is a controlled breathing activity or intervention, and it's called box breathing. If you're not familiar with box breathing, you want to learn about that box breathing. And let me tell you, I tried to practice. I've been using these interventions just more recently. Just anytime I need to calm down or I want to relax, and I was going to try to, test it to lower my heart rate so I could tell y'all, yeah, I just did this because that actually did happen on last week with some of the one of the tip interventions I was using. Lowered my stress level from a 36 to an 18 in about 15 minutes or so. But anyway, I didn't get to try to test this out because it kept putting me to sleep. This one I'm gonna show you. It put me to sleep literally 3 times, but I think I'm just tired. But anyway, so you can use this with your clients right here. Box breathing in this, I'm telling you, it'll put you to sleep. So, but that's the point, right?
Go ahead and make yourself comfortable. You'll inhale through your nose for a count of 4. Hold the breath for a count of 4. Exhale through your mouth for a count of 4. And hold the breath for a count of 4. Alright. Inhale 1, 2, 3, 4. Hold 2, 3, 4. Exhale 2, 3, 4. Hold 2, 3, 4. Good. Inhale 2, 3, 4.
Okay.
Hold
I mean, that
2.
thing is kind of addictive. It just makes me want to keep doing it every time. But that is something that you can either walk your client through that intervention with the box breathing, you know, with you verbally counting and letting them go in, letting them hold. I was doing it wrong at first. But that right there can in the goal a lot of times, like I was talking about tip, scientifically with some of these interventions with tip as well as the box breathing has been proven from what I have seen to actually lower your heart rate. So like on the spot, it can lower the heart rate, which ends up lowering the stress levels, which ends up helping you to, again, what are we doing? Activating the parasympathetic nervous system. And these are activities or interventions that support with helping to do that, right? And then we have I don't know so much about the parasympathetic on this paradoxical approach, but we're kind of trying to help the supervisees to understand ways to support this client who is being dysregulated. Okay, they're being dysregulated, or to provide some preventative ways to support them so they don't become dysregulated. And this is a video that I've often shown to my supervisees. And then an interesting one here is and these are all awesome videos. I didn't get to show them all because of the time, and as you can see, we're at time too. Probably nobody will make it this far, but we have the vagus nerve stimulation, vagus nerve stimulation. Okay, and those types of interventions, and these interventions are really interesting because you have to know a little bit about the vagus nerve, and I'm still learning that myself. But again, the idea is to activate the parasympathetic. This is a way to do that. And what happens is you have simple things such as just humming or singing, vocalizing loud, low tones, splashing water on your face. And this kind of reminds me of the tip intervention, which is also used in DBT or was used in DBT. Again, when you're putting your face in the water and cold ice water. And boy, I might do that after this because it's just relaxing, right? And so these are some interventions that you can use with your clients, okay? So again, we're talking about when we have clients who have been dysregulated, how do we help them, support them to become regulated? Sometimes it's not just about the talk therapy, in other words, using the CBT and things like that. Sometimes we need to teach them how to better manage their bodies. And these are some interventions I think will be helpful. I'm going to try to clip everything as much as I can in case you want to use this yourself or get some additional information. I hope this has been helpful.